California, the most populous state in the country, unveiling its plan for the next phase of the pandemic.
What we're announcing here today is about turning a page, moving from this crisis mentality, moving from a reactive framework to a framework where we are more sentinel in our approach, that we stand firm and confident as we lean into the future, moving away from a reactive mindset and a crisis mindset to living with this virus.
And joining us now is Dr. Ali Khan. He is the Dean of the College of Public Health at the University of Nebraska Medical Center. Thank you so much, Doctor, for being with us. I think first, let's talk about masking and where and when you think it is safe for adults and children to begin dropping masks inside.
Good morning, Brianna. So if you're fully boosted, that means you've completed a three-dose series, then you can be comfortable dropping your mask based on your personal risk level, how much risk you're willing to take, and what the risk in the community looks like. I personally will probably wait until cases get down to moderate levels within my community. Right now, across the United States, I think except for Maryland, everybody is high. So I would wait a little bit before I took off my own mask. But again, I'm talking about people who are fully boosted. The release of all these mask mandates is going to be most problematic for those who are unvaccinated or under-vaccinated. They will likely have a rebound of disease within those communities.
Dr. Khan, first of all, you've been one of our favorite people to talk to over the last 2 years for two reasons. One, the comic books behind you, which I love every time. But number two, at the end of every segment, you tell us mask on and you put your mask on. And one of the reasons we're excited to talk to you today is to figure out, as you started just talking about it right there, is when to take the masks off, as many states and cities are now doing. But you say when we have these elevated levels of transmission, which is everywhere, I mean, if you look at the map, it's all still red. It sounds like what you're saying is even if you're boosted, the levels are too high for you to be comfortable with it.
It depends on correct, John. So again, it depends on what your personal risk level is. So I'm out and about in my community all the time. I travel all the time. However, when I'm in a crowded indoor space with people where I don't know their vaccination status, I'm still wearing a mask because I don't want to get infected at all, because I don't want to get long COVID. I don't want to get the mental health complications we see in people who get COVID infection. So I'd rather stay away from that. Other people may not worry about a mild illness and say, okay, I'm willing to go out and about. But again, boosted. For those of you who are unvaccinated or under-vaccinated still, this is not a disease you want. You get severe disease, and we have 2,000 deaths a day. I mean, that would make COVID a vaccine-preventable disease the leading cause of death in America if we stay at 2,000 to 2,500 deaths a day right now.
When you say moderate levels, because that's kind of the tipping point, I think, for if you're considering taking off your mask in a smart way if you're boosted. What is that? Like, what is the moderate level per, say, 100,000 people?
So CDC puts that at about 77 cases per 100,000 people, 49 cases per week. So you can look on the CDC website, somewhere around there, 5 to 10. Is where people would feel comfortable. Right now, nationally, I think, Brianna, we're about 35 cases per 100,000. So about a third of that, I think, would be pretty good for moderate. So we have to go from high to substantial to moderate.
So I want to ask you a question. This was something I came across just in my family. I have a relative who is a teacher in California, and even ahead of this California recommendation, they're making masks optional in schools, which I think is something in this area that a lot of parents are going to be taking advantage of. And I was looking at the case count for this county, and it is based on the 7-day average, 134 cases per 100,000, or 106 cases just based on yesterday's count per 100,000. That's like huge compared to what you're talking about as moderate.
Yeah, correct. But I like to remind parents that schools don't need to become ideological battlefields, right? Mm-hmm. They have the ability to protect their own kid by getting that child vaccinated. They have the ability to have that child wear a high quality mask to protect them. This is not, January of 2021. We have vaccines available for kids. We have free masks. So we have options for parents that were not available last year when they were worried about sending their kids to school.
Can I read the thought bubble that just went up over Brianna Keilar's head right there? When you said we have vaccines for kids, the thought bubble that went right up was, yeah, but not for kids under 5. Not for kids under 5. So what do you do?
I love that age for kids under 5. So I think the data is pretty good for kids under 5, that if you surround them with people who are vaccinated, Brianna, the kids don't get infected. There was a nice report that came out, I think, 2 weeks ago from CDC. So if their parents, grandparents, teachers are vaccinated around them, the kid does just fine. So there is ways to even protect those for whom vaccines are not available at this point, that small group of kids under 5.
My child in particular is around other unvaccinated kids under 5. But that's also, like you said, you make the risk assessment. And for us, obviously, you know, this schooling is so important.
Can I ask?
Go on, yeah.
Because the issue then becomes, Dr. Khan, towns in states are making this decision based on the risks that they want in their localities, and parents are making their own decisions based on risks. But the CDC still says no. At what point, if the CDC is telling people something that they know that people are ignoring, what's the point?
Well, John, CDC is telling everybody to go out there and get boosted, and the national boost rate is 28%. So it's the same exact argument, right? If people got boosted, we'd be in a different place. And we know that other countries that are releasing their mask recommendations and other social distancing recommendations in Europe, they're able to do it because their rates of vaccination are so much higher than the United States, which goes back to where we started with California. Very appropriate for California to have this conversation. Their vaccination rate's higher than the rest of the United States. They're about to vaccinate kids, I believe, this fall, which will increase their vaccination rate even more. So you have lots of latitude to drop masks, drop social distancing if you're willing to get vaccinated.
Dr. Khan, it is so great to talk to you. I think you always help us kind of balance all of these different things, because that's really what it is. It's about balancing priorities and safety and risk, and you made a lot of sense. I appreciate it.
Thank you. Always a pleasure. And you know my message, you know what it's going to be. Get boosted.
Get boosted. That, what, 72%? Am I doing my math right? Get boosted, that 72%.
Yes.
Dr. Khan, thank you so much.